Welcome to the I Love CVille Show, guys. My name is Jerry Miller, and thank you kindly for joining us on a Thursday afternoon in downtown Charlottesville. Ladies and gentlemen, today's program will move the news cycle. Today's program will absolutely impact and influence what is talked about this afternoon, tomorrow, through the weekend, and throughout the rest of 2026. Folks, we have the skeletons. We have the receipts. We have the dirty details of the alleged white-collar racketeering that transpired at the UVA health system. The documentation, props and kudos, hat tip to the Jefferson Council, a Freedom of Information Act request by the Jefferson Council, 239 pages that Judah Wickhauer and I have poured through over the last 24 to 28 hours. We would have talked about this yesterday. We had an interview previously scheduled on the docket. That's why we did not. We had the documentation in our possession late morning Wednesday. However, the extra time has given us even more opportunity to prepare for this program. I want you to look at the screen for the headlines. The corruption, even more significant and even worse than we initially anticipated, ladies and gentlemen, and it's not even close. I'm going to give you a couple of juicy tidbits that really struck me as absolutely shady as Craig Kent, then the CEO of UVA Health, now an embattled, jettisoned executive who got a bag of money to be quiet, hush money, and quit as the CEO of the health system. At one time, the highest paid University of Virginia employee. At the start of COVID in March of 2020, when he still had his job, when the world was terrified because we really didn't know what the pandemic was about, the Commonwealth of Virginia had 80 tests in its possession, the entire Commonwealth, 80 COVID tests for 8 million people susceptible to COVID and the pandemic. When we were all scared to go outside, when we were all terrified to go to the grocery store, when we were all wearing hazmat suits in our cars, driving around communities because we weren't sure if this pandemic, this virus, this sickness was something that you could get on your fingers by touching things. Remember when we were afraid to walk outside our house and we changed our clothes in the garage before we walked inside of our home? We literally did that. We took our shoes off, our jackets off, our sweaters off, our hats off in the garage for fear of walking in our house because of COVID. Craig Kent was so effing scared of COVID that he instructed the hospital system, who had 80 tests, 80, and 8 million people in the Commonwealth. And he said, hospital system, I want you to test me first for COVID before anyone else. Then I want you to test my direct family first before anybody else. And next, I want you to test hand-picked VIP friends of mine first before anyone else. And what's even worse? Besides cutting a line, no one likes a line cutter. Do you like a line cutter? I hate a line cutter. Do you know what's worse than the abuse of power? The cover-up. After abusing his power and jumping to the front of the line because he was so terrified of getting the touchy-feelies from COVID, he told his staff to cover up by making phony medical records that he took the COVID test from the actual people who had it. He said, good God, what I did was wrong and I know it, so cover this up and don't tell anyone. We're going to unpack this story in 239 pages today on the I Love CVille Show, and then I want the Washington Post, the Richmond Times-Dispatch, the New York Times, Lee Enterprises, radio and television to cover this story aggressively and in detail. Craig Kent, ladies and gentlemen, told his staff to leave hospital beds empty because those COVID patients could not pay the type of revenue that elective surgery patients could pay. So he literally closed the health system doors to men and women during the pandemic that were sick or dying of COVID and said, "You're not welcome here because we would rather do elective, high-dollar, expensive surgeries instead." Craig Kent, these 239 pages allege, and the people making the claims are his peers. He used threats. He used the threat of promotions and demotions. Craig Kent leveraged power to keep people quiet, to keep people scared, to keep people's heads down. He stripped the health system of resources and still ordered expensive, risky surgeries to happen. One doctor in these 239 pages said he was doing life-risking surgery with such limited resources that in the middle of having someone's life in the palm of his hands, thoughts were running through his mind that this person could die because I don't have the right technology, staff, and resources in the room. I knew it before the surgery started, and the CEO ordered us to do it. What have I gotten myself into? Tag a friend and get ready for 45 minutes of content that is going to absolutely flabbergast, infuriate, and drive you bananas. Studio camera, 2-shot, Judah Wickower. We've spent 28 hours looking at this. 28 hours. The first impression after pouring through this documentation and you and I talking that came to mind for you, Judah Wickower?
I think the first thing that came to mind was just a little bit of not payback, but a year or so ago, when all those doctors signed the
anonymous 128
no confidence report, yeah, and they were derided. I think this is a little bit of comeuppance for them. The fact that obviously this still requires some reporting, some investigation, but I think put together, all of this tells a pretty bleak story that this wasn't just something that 128 physicians made up because they didn't like someone.
This went as far as Jim Ryan. These doctors, for years, had tried to report to Jim Ryan, the president of the University of Virginia, what Craig Kent was doing.
Yeah.
Literally multiple attempts. UVA Health System, the top revenue generator of anything University of Virginia related is the health system. Mm-hmm. Okay? The operating budget for UVA in totality on a yearly basis, we learned this from Bert Ellis when he came on our show, is more than $5 billion. $5 billion. And the UVA health system is the top driver revenue-wise.
Yeah.
And for years, doctors in this health system, and you see it in the documentation that we have in front of us, were trying to notify Jim Ryan.
Yeah.
And the former president of the University of Virginia belittled, even scolded the anonymous 128 doctors, saying that you were nothing but angry, bitter discontents that any organization has.
And that was after 4 years. We don't know what his response to a lot of this stuff was when it was coming in. For instance, the UVA Health's chief medical officer resigned in 2020, citing specifically concerns about Dr. Kent's priorities and leadership. This was 2020 in April, and we obviously don't know Jim Ryan's response to this, but we do know that 4 years later, 5 years later, when the 128 physicians wrote their letter, as you said, he waved it aside. He made them out to be, crackpots, made them out to be what the 10% of discontented people you find at any business. I mean, it's amazing that for 5 years, that's still his response.
Jim Ryan then apologized. He then issued an apology after more investigation. Well, Jim Ryan issued the apology because he understood that the receipts were out and the skeletons in the closet were about to be exposed, and he was going to look terrible. So he tried to save face by offering an apology. Was it 7 months after he called the doctors crackpots? 7 months later, he finally admitted fault, saying he shouldn't have done that, calling them bitter crybabies, the guys and gals that didn't get an invitation to the senior prom and they wanted to whine and cry about it. That's what Jim Ryan called this anonymous 128. The reason he did that, now we know, a documented investigation. And these 239 pages that were uncovered in a Freedom of Information Act request by the Jefferson Council, ladies and gentlemen, another hat tip to the council there, is, as they've indicated, the tip of the iceberg. There's a hell of a lot that's still under cloak and dagger, lock and seal, buried in a Brinks trunk somewhere, the University of Virginia and the Board of Visitors hoping with fingers crossed and bated breath that the public will never see. Somehow these 239 pages are out, FOIA, and we got them, and we're talking about them, and the corruption is even worse than we thought, and it undoubtedly paints Craig Kent in the worst light, Melina Kibbe in the second worst light, and goodness gracious, Jim Ryan in the third. And I'm going to ask you a very direct question, Judah Wickower, because you and I are the odd couple in a lot of capacity. Okay? Emotions on his sleeve, yours truly. Some folks wonder if the robot has any emotions at all. I've known him for 16 years. He's got plenty. If you cut him, he bleeds.
Or he punches you in the face.
I've fortunately never seen that side. Should Jim Ryan have been fired? Tough question for you, maybe the toughest I've ever asked. After reading these 239 pages and known for years that men and women with credentials and resumes and experience, men and women that have character and credibility, that have diplomas from the most prestigious institutions in the nation, literally are telling Jim Ryan on multiple accounts over years that white-collar racketeering, corruption, and downright shady was happening under his nose, and he did nothing because the health system was making so much money.
Yeah, I think he should have been fired. I think there's not really any evidence that he did anything in particular except ignore all of these problems for
years,
at least 4 years,
because the health system made so much money.
I mean, you can say that's why.
That is why.
Okay.
What else would be the reason?
I mean, I don't know Jim Ryan's mind. You can say that, but it could be a number of reasons that don't necessarily have to do with money coming from UVA.
Okay. I appreciate your statement. The viewers and listeners are smart people. The organization or the entity or the division or the outfit or the branch on the family tree that drives the revenue is the health system. And for 4 years, Jim Ryan turned a blind eye to what was happening at this health system. It's happening very obviously to me because of all the money that was coming in and out of those doors for UVA.
I mean, that's certainly got to be part of it.
I'm going to ask you a follow-up question
But
here.
do we really think that money was the only thing pushing Jim Ryan's reactions?
Money, PR disaster,
Yeah.
the collateral damage of white-collar racketeering, the fact that he's finding out that the CEO of the UVA health system in March of 2020 is ordering his staff to take the 80 tests they have on hand and pushing himself, Craig Kent, to the front of the line to test himself, then his family, then cherry-picked VIPs before average Joes and average Jennifers get a chance to get tested. The
Yeah.
fact that Craig Kent is ordering the health system during peak COVID to turn away patients showing signs of COVID that are struggling to breathe, that are weak, that can't get out of bed, that are dehydrated, that are sick, that are on the cusp of being 6 feet underground, and Kent tells staff, don't let them in our hospital because that type of treatment doesn't make us any money, like boob implants, like facial plastic surgery, like reconstructive surgery, like new knees and elbows. That's what he said. What else did the man do? What else jumped out at you from this 239? I mean, good God, we could spend 2 hours telling you some of the nastiest stuff we've ever read. Go.
I mean, aside from turning people away for COVID because, as you said, they wanted to focus on elective surgeries because they pay more money, multiple departments at UVA Health cite serious patient harm, including, but not limited to, strokes, blindness. Imagine going into the hospital and because of, not even because a doctor made a mistake, but because somebody at the top just, I mean, I don't know what the reason was that caused this, but blindness, near fatal surgical events, not to mention unsafe emergency department conditions. I mean, that's probably, thinking of all the people that have gone through the UVA Health doors, expecting what, world-class treatment, because this is UVA Health, to go in and find out years later that that the guy actually running the place, the guy at the top of UVA Health was making it impossible was making it unsafe to even go in there. I mean, that's insane.
Read the portion where the doctor was talking about surgery and not having the resources on hand.
Was that the part on the actual report? Let's see.
That's on the summary we put together.
Okay.
This right here is just malpractice.
Are you
Definition.
talking about the pediatric oncologist?
Read that.
The guy in charge of, for anyone that doesn't know, pediatrics has to do with kids. Oncology has to do with bone cancer. Pediatric oncologist reports that he was continually pressured by Dr. Kent to perform high-risk bone marrow transplants on children without the required staffing or infrastructure, essentially putting the lives of children at risk to, I don't know, cycle them through the system, make that money, get them out. I mean, that's your children. I mean, there's so much in here.
How is doing that type of surgery on children when you know you don't have the technology, staff, or infrastructure to do it safely? How is that any different than grabbing a kid off the street, throwing them in a white van, and taking them away to a very unsafe place?
I'm not going to touch that.
Kids and parents go into a hospital. Their kid is sick and potentially dying. They're desperate and vulnerable. They go to a doctor who looks at them in their face and is performing life-altering, life-saving, life-risking surgery. And in the back of the head, the doctor knows that he's being pressured to do this to make money when he doesn't have the resources, infrastructure, technology, or support staff to do the actions in their proper fashion.
Yeah.
That's what happened. How's that any different than grabbing a kid, throwing him in a van, taking him away from his family, and putting it in some nondescript backwoods basement? Other stuff from the summary. Judah Wickower.
Well, let's see. You mentioned the COVID response. He was accused of centralizing all decision making. He essentially said, "No decisions will be made without me being there." Obviously, there are so many decisions going on at a hospital that to centralize all decision making under one person is going to create a bottleneck of not being able to take action without running something by this guy. He undermined physician-led safety protocols, prioritized high-margin elective surgeries, as we've mentioned, turned away COVID patients, limited testing, directed VIP testing when tests were scarce, and not to mention cutting the staff pay without later reimbursement. That was the COVID stuff. There's financial and operational mismanagement, emergency department policy, retaliation that we've mentioned. I mean, where do you want me to go? Hiring and credentialing practices. It's amazing that this went on for 4 years and nobody would listen.
You know why no one listened? Why, viewers and listeners, did this go on for 4 years? Why was this allowed, viewers and listeners, to go on for 4 years? Do you want to answer that?
Go ahead.
It's called money.
That would have been my guess, but...
It's called money.
Yeah.
Now, with the benefit of hindsight, viewers and listeners, should Jim Ryan have been fired?
I think so. Looking at all of this, the fact that he could overlook all of this puts him essentially at the same spot as Dr. Craig Kent. He may not have known.
Ignorance is not an excuse.
He may not.
Ignorance is not an excuse.
I'm not saying ignorance. I'm saying he
turning
may not,
a blind eye is not an
have been
excuse.
involved in making the decisions that Dr. Craig Kent made. He may not have been. I'm giving him the benefit of the doubt. There is so much in here. I find it hard to believe that he was apprised of all of this, and certainly not at the beginning. At some point, though, you have to think that he'd heard enough to know that something stank.
Studio camera with headlines on screen. Then I'm going to read comments. I'm going to get people's photos on screen. Bob Yarborough, his comment's going to be read first. John Blair, Deep Throat, Warrior AG, Albert Graves, Giddy Up and Get Ready. Viewers and listeners, let us know your thoughts. Put them in the feed. I will relay them live on air. I have 3 newspapers on the TV show right now, watching us right now. I encourage the Washington Post, the Richmond Times-Dispatch, the Daily Progress to do a deep dive investigative report on these 239 pages. Mm-hmm. Television and radio, you should be putting this in your news cycle for the next 3 to 4 days minimum. Bob Yarborough's photo on screen, the king of Redfields. He says, man, as a former journalist, I used to be a person who conducted these type of reviews for organizations across the country and was responsible for drafting these reports. This one is unequivocally damning, as unequivocally damning as any I have ever seen or read. Honestly, they should not have allowed him to resign. He should have been fired. Absolutely unbelievable.
No doubt.
I've been told Craig Kent was given a bag of money when he resigned to stay quiet and leave and get the hell out of Dodge. Not only did he resign, I've been told he got millions of dollars at resignation to leave and never say anything again.
Good old golden parachute.
Is that a golden parachute or is that hush money?
Do they have to be different?
Albert Graves' photo on screen. Where there's smoke, there's fire. And I said this when Jim Ryan resigned. There's a whole hell of a lot more going on than meets the eye. Y'all take another lap with your ex-president. And just think, Jim Ryan pulled the traditional Dumbo-crats play card and blamed Trump on why he was fired, why he resigned. Kickbacks are a MFer, especially when they get revealed, and trust me, this ain't the last shot fired. And he says it was allowed to go on because Jim Ryan was president. A spade is a spade. Albert Graves says, Judah, poor take when you have numerous complaints about the health system and they are sent to the president and he does nothing. He is just as guilty as all those health system employees are.
I don't disagree.
Janice Boyce Trevelyan wants to know if Jim Ryan was one of the hand-picked people Craig Kent said could get a COVID test. In March of 2020, the Commonwealth of Virginia, when the pandemic just started, had only 80 tests within Commonwealth confines. Craig Kent instructed the health system to test himself first, his family members second, and select VIPs third. And then he instructed staff at the health system to smoke and mirror, disguise, and cover up that he skipped to the front of the line. Phony medical records to disguise it. Was Jim Ryan one of those folks that got tested and handpicked by Craig Kent? That's a great question from Janice Boyce Trevelyan.
Yeah.
John Blair's photo on screen. Jerry, I have not said this. I have said this the entire time, I think is what he's saying. The true story about UVA, the BOV, and Ryan is about the medical center. Yep, he said that. I have said this the entire time. The true story about UVA, the BOV, and Ryan is about the medical center. We talked in the summer of 2024, long before the Jim Ryan BOV drama, about the medical center situation being an enormous issue. You called it the biggest story in UVA history. It is amazing how off target so many people have been about this story. We both know so many people at the hospital who said bad things were occurring in 2022, 2023, 2024, long before the summer of 2025. He is absolutely right. I was sitting poolside in the summer of 2024, poolside. There was a surgeon sitting next to me of the emergency room variety. I was drinking an IPA. Cue Judah to say something.
What else would you be drinking?
The emergency room surgeon was drinking bottled water. He watches the show. We were talking about this story. He said, just wait. This is just the beginning. And I said, please tell me. He goes, just wait. This is just the beginning. His exact words, I'll never forget it. Lower thirds rotated on screen. Jason Noble, his photo on screen. Money and cowardice was the reason. And Judah, he says, you are not an AI robot. You know the answer. Conan Owens' photo on screen. Surgery makes more money than abduction and human trafficking, Jerry. So I would imagine that comment means it's worse. Vanessa Parkhill, are you talking COVID test or vaccination? It's the test, right?
Yeah, that's what I've read. It's the tests.
It's the test. And these 239 pages are based on interviews that this third-party law firm, not tied to the University of Virginia, this third-party law firm interviewed the doctors. Like Bobby Chabra's name is all over this report.
Oh, yeah.
Bobby Chabra is a man of tremendous, I hope Bobby Chabra hears this, a man of tremendous respect, credibility, integrity, character, the pinnacle of the profession, Bobby Chabra. The head of the UVA Physicians Group, the man who created the Orthopedic Center on Ivy Road.
Essentially told to step down from both of those by Dr. Kent.
I'm about to pass the baton to you. Get the receipts.
Okay.
I think it's on pages 5 and 6.
Yeah, I think you're right.
Very early in the report, pages 5 and 6.
I've got 6 starred.
Bobby Chabra, one of the most credible doctors in the world, a world-class, hand, wrist, and elbow surgeon, does the hand, wrist, and elbow surgery for all the UVA athletes. Bobby Chabra bought a house from Bobby Chabra, yours truly, in March of 2020. Class A+ guy. Craig Kent absolutely despised and hated Bobby Chabra because he was because he was an established leader at UVA Health. And he had the respect of his colleagues and professionals. And they were willing to follow him through fire. that he was a man who moved mountains. So Kent must have felt threatened by Chabra, the head of the physicians group, because he was a guy that had more perceived or actual power than Kent, the CEO. And listen, ladies and gentlemen, what Craig Kent did to Bobby Chabra, pages 5 and 6. Giddy up and go.
Well, I just wanted to add that I think he probably felt that way about anyone with any amount of power that wasn't that wasn't chosen by him. First, let me start by
pretty
saying
sure he's a triple who, Bobby Chabra.
Chief Medical Officer and Interim CEO Chris Gamagami. I don't know if I'm pronouncing that right, but in April 2020, he sent UVA President James Ryan a letter explaining why he could not, in good conscience, continue to work with Dr. Kent. Now on to and resigned his position at UVA. I find it hard to believe that, like the others...
Chabra,
okay,
focus.
Okay. Bobby Chabra was the...
He's reading verbatim from the report here.
Do you want me to read
verbatim?
Read it
verbatim.
Additionally, senior faculty members who spoke up for their fellow physicians have been stripped of their leadership positions. Dr. Kent's treatment of Dr. Bobby Chabra is a case in point. Dr. Chabra arrived at UVA after medical school and has remained on grounds for 34 years. He has been a full professor since 2008 and the orthopedic department's chair since 2013. He has served on the School of Medicine Board for 12 years and served on the Health System Board for 7 years. He served as the UVA Physicians Group President for many years, thereby ensuring that the voices of the physicians he represented would be elevated in leadership. Dr. Chabra served in almost every leadership position available to him at UVA and received many of its rewards. He also designed, oversaw construction, and directed UVA's busy orthopedic center, which is widely considered a model for other healthcare institutions across the U.S. And yet, in their very first meeting, when Dr. Chabra offered his support and advice, Dr. Kent rebuffed him. Soon afterward, Dr. Kent ordered Dr. Chabra to step down as president of the UVA Physicians Group and threatened to take away his directorship of his own orthopedic center and his position as chair of orthopedics if he didn't do so. Even after Dr. Chabra complied, he said Dr. Kent stripped him of other leadership roles, thus undermining the votes of the various boards on which Dr. Chabra held a position. And here, Dr. Chabra is quoted as saying, "I hope you'll understand that this is the truth. These are facts." This was told to Williams and Connolly, the
law firm.
Yeah. "This is the worst morale I have seen at this institution in 34 years. We don't have proper staff or equipment. You have to beg for support. They hire the wrong people, and they don't vet the people that they do hire." And that's what we've got on this section about Dr. Chabra.
That's about a page and a half of 239 pages. Comments continue to come in quickly. Stacy Baker Patty, watching the program. She says, within this report are the names of some of the most well-respected physicians in the area, if not the nation. Mm-hmm. Excellent people, high-integrity folks. Barbara Becker Tilley, her photo on screen. I have deep respect, Barbara Becker Tilley says, for Dr. Bobby Chabra. If all units at the medical center ran under him, it would be an uber-organized organization. Bob Yarborough, I love Bobby. Chabra makes his community a better place. There's comments every... Bobby Chabra, I hope someone tells you, texts you, that we're talking about you on the show. I want you to know that you are respected tremendously by me on this show. I think you already know that. By Judah. And there's 36 comments all over the I Love CVille Network right now from various people giving you props and praise. How you were treated by Craig Kent is despicable, it's dirty, it's downright disgusting. It is the opposite of what you would think would happen at the C-suite in a multi-billion-dollar corporation and organization. It shows you that corruption and a hunger for power. is not confined to criminals and back alley dealing and men and women with weapons in their hands. That kind of zest or hunger for power could also involve stethoscopes, white coats, and Mont Blanc pens, and pleated pinstripe suits. Just absolutely crazy what's in this report. More comments are continuing to come in. Judah, you get the next tidbit ready to go. I'm going to read this comment from Deep Throat, number 1 in the family. Deep Throat says this: some questions I have. Did Jim Ryan know about this stuff, and when did he know it? If Jim Ryan knew it and let this guy stay on, that's real bad. And if he didn't know, well, that's negligent. Ryan's departure is looking more and more justified. Mm-hmm. Deep Throat says this: which do you think is more central to good management of a university? Preventing fraud and self-dealing, or going on cool jogs with your students around grounds at 7 in the morning on a Tuesday? Total joker. Bye-bye and good riddance. Deep Throat says this: and the fact that a relatively newly hired head of the health system felt comfortable committing these sleazy acts tells you that Jim Ryan inspired neither fear nor respect in the rest of university leadership. I'll add to this. Now, these are my words. Craig Kent came to UVA with this reputation from his previous employer.
In Ohio.
In Ohio.
Yeah. And to answer Deep Throat's question, President Jim Ryan did know about at least some of this for most of the time that Craig Kent was there, because Craig Kent assumed leadership of UVA Health in February of 2020, and it was only, 2 months later, in April of 2020, that as I mentioned earlier, Chief Medical Officer and Interim CEO Chris Gamagami wrote a letter to President James Ryan explaining why he couldn't continue to work with Dr. Kent.
You guys want some things to read that you may find intriguing? Read drcraigkent.com, drcraigkent.com, drcraigkent.com. I'm going to go check the page source, basically the back-end code of this website. It is a WordPress website, which is the content management system. I have been told, and I'm getting this text message now from someone who is asking for anonymity. The health system is on the show and watching the show. This text message has just come in from the health system that Kent, according to this anonymous source, instructed staff at the health system to market and build his personal brand, and here's an example of it, and use company resources and staff to do it.
I think that's one of the least egregious things he's done.
That straight from the health system. He was the co-health system leader at Ohio State University. And before transitioning as CEO of the University of Virginia Health, while the co-health system leader at Ohio State University, there was a cloud of alleged corruption that followed and circled Craig Kent.
Yeah.
And that cloud of alleged corruption that circled Craig Kent just went from the Midwest to the East Coast to the best place to live in America, where it caused bad dreams, a lot of people to get hurt and sick. There's an active antitrust lawsuit going on. There's an active lawsuit going on, not antitrust, excuse me, but there's an active lawsuit going on right now that alleged malpractice caused the death of a patient. It's active right now. Comments coming in faster than I can keep up with. Judah, tidbits, then I'll get to comments.
He got this report documents multiple earlier no confidence letters, formal complaints, and resignations. I think what's not worst, but the resignations are all of these came from both UVA and Ohio State, raising concerns about not just one or two behaviors, but a long-standing pattern of poor leadership. And this guy should have been shown the swinging door, like almost as soon as he came in. The signs were there, as I mentioned, within months of his taking leadership of UVA Health. There were, I think, clear signs that there was a problem, and the fact that that President Ryan ignored them is pretty bad.
And the interesting thing about this, Judah, is this is one like major catastrophe, right? The other catastrophes that were on the Ryan Trail of Tears was how the triple murder was managed before and how the triple murder was handled after.
Yeah.
The pro-Palestine pepper spraying protest in the Virginia State Police.
I'm not even sure how that fits in with everything. That is one of the biggest mysteries to me, is the fact that you would think that if someone else gave the order, it would be pretty easy for him to step aside and say, look, I'm just taking orders here.
Well, especially now that he's no longer the president.
Well, yeah.
Because we both think that came from Youngkin.
Yeah.
That's out of character for Ryan. But without Ryan saying anything, it's on Ryan.
Yeah.
It's on Ryan now until Ryan
things.
says, Glenn Youngkin told me to do it.
Yeah.
But we put it on Ryan with the Ryan Trail of Tears.
But you're right. There were a lot of red flags starting in 2020.
And the very intriguing thing about it is money hides so much, because he's championed and saluted for his fundraising ability and how he's navigated capital campaigns and the construction of new buildings left and right all over grounds. That's how he's championed.
Also being on the correct side of politics, and being
air quotes correct,
and being a personable, charisma goes a long way.
Oh yeah,
towards getting out of stuff.
The approachability and affability of a man who puts his tie at half mast and rolls up his Brooks Brothers button-down shirt sleeves to past his elbows and perches on the edge of his desk and has fireside chats with students via Zoom during COVID. That builds a lot of goodwill and equity, and goodness gracious, you meet Jim Bryan at the UVA chapel at 6:30 in the morning on a Tuesday, and you go for a 3-mile trot around Thomas Jefferson's grounds with your Ragged Mountain running shop shoes, and then you finish with an everything bagel cut in half and some coffee from Bodo's on the UVA corner. You are going to have a lot of PR built, a lot of equity built. Mm-hmm. Smart man in some ways. We have 7 media outlets watching the program. If you are not covering this story, you are doing the community a disservice and a disjustice. Surprisingly, the report came out yesterday, and mid-morning, and it hasn't been on any media platform since. Can you explain that?
It's a lot of pages to go through.
But why wouldn't there just be a cursory report or some kind of like heads up? This is what's a who, what, when, where, why, and then like a tease in that who, what, when, where, why that the investigative report is coming. It's just such easy, low-hanging fruit.
You think it's a problem with the editors?
Or is it that the health system is one of the largest advertisers for media platforms in the entire region and the state? Look at all over the John Paul Jones Arena. Look at all over Scott Stadium. Look at all over the legacy airwaves, print, radio, and television. You see UVA Health advertising everywhere for a business model, an eroding business model like print, radio, and television that's just basically trying to keep the lights on. Do they poke the bear of one of their top advertisers by doing an investigative report on what is true journalism at the risk of their shop or their outfit, their organization being shut down forever because they lose a top 5 payer to their model? Is that what's happening?
Potentially.
Like, who would you say is doing really good work right now in the journalism space? I would say Mike Barber and CVille right now are doing really good work, right? CVille right now is doing really good work. I'm on CVille right now. The second headline, go to CVilleRightNow.com, Judah. Mm-hmm. The second headline on the turnstile, what do you call it? The carousel of stories?
Yeah, carousel.
Is a positive story about UVA Health. Yep. It says UVA Health gets $500,000 to treat infectious disease outbreaks. Yep. Nowhere on CVille right now is there any mention, ladies and gentlemen, of these 239 pages in this FOIA.
Yeah.
But then you listen to the morning show this morning and you heard Dr. Chabra on with Jay James. And you catch the news on the radio and you hear 30-second ads for UVA Health left and right, and they're the sponsors of the broadcasts for the basketball and football games, paying the media hundreds of thousands of dollars, if not more. Is legacy media afraid to cover the story because the health system is so prolific with its advertising? Sincerely, I have that question. No, I'm sincerely asking that question.
You know I don't have the answer to that.
No, but...
Yeah, no, I get it.
I'm going to go to dailyprogress.com.
Yeah.
I'm on dailyprogress.com. I don't see any mention of this, but I see health system advertising. Let me go to NBC29.com. I'm on NBC29.com. Do we see NBC29.com? There's no mention. Is there any mention of this? No, but there's a paid ad about severe flu season and respiratory illnesses at UVA Health is trying to get in front of it. There's nothing mentioned. Let's go to CBS 19. CBS19news.com. Oh, there's a UVA Health ad. Use CBS 19, the lead slot. Grant funding supporting preparedness to respond to infectious diseases with UVA Health in the lead slot. Ads for UVA Health, but no mention of this story. Do you see? Judah, tonight, when you're at your mansion, living as a single man, drinking your high-dollar scotch and your expensive Williams-Sonoma glasses as you eat your T-bone steak and your loaded black baked potato, and you trot in your silk robe and your tighty-whities to bed while streaming 72-inch screen Netflix, watching Real Housewives of Orange County, you better sleep with one eye open because we're talking about the story.
Because I'm in somebody else's house.
Sleep with one eye open tonight. Rest in power, Liza. I would have felt a lot more comfortable if Liza, the wonderful I Love CVille mascot, was sleeping bedside so she could alert you to the Kennerprise that was coming in your back door.
Oh, you think they're coming for me first?
I got the German Shepherds. And who in their right mind would mess with a house that has 2 Miller Maniacs in there?
Yeah, I ain't messing with German Shepherds.
Or the German Shepherds. Albert Graves, the legacy media, taking the kickbacks. Why is it not being covered? Deep Throat, Jerry, your search of media for this story reveals what it means to live in a company town. The old coal mine owners have nothing on UVA. Right, Deep Throat? I literally went to CVilleRightNow.com, DailyProgress.com, CBS19News.com, NBC29News.com, CVilleWeekly.com, CVilleTomorrow.com. I went to every single one. Let's go to Richmond Times Dispatch. Richmond.com. Richmond Times Dispatch.
I mean, that's essentially...
It's Lee Enterprises. It's their flagship brand. There's nothing on the Richmond Times Dispatch about this, but there is UVA Health advertising.
Yeah.
Jefferson Council, tip of the cap to you for the FOIA. Return the tip of the cap. We've provided quality content for you to cut up into segments and sizzle reels that you can then syndicate on your social media platforms, because we've broken down this story and analyzed this story with an unafraid and unabashed microscope. I should say stethoscope. Carol Thorpe, Tina Wyant Breeden, Logan Wells Claylow, Betsy Hill Nugent, Philip Dow, William McChesney, Vanessa Parkhill, all giving us props on the show. If you think we're doing a good job, like and share the show. Let someone know what's going on. Share the show. Transparency is paramount for a safe society. The most valuable aspect in a lot of ways of media and local journalism is the fear of accountability. Because when there is not the fear of accountability and your name potentially in the print of in front of thousands, if not tens of thousands, if not hundreds of thousands of people for wrongdoing, when that fear of accountability is not present, you push the envelope into gray areas that become black. Into threats that become white-collar racketeering. And white-collar racketeering that becomes corruption, and corruption that becomes malpractice and death.
I wonder how much that knowledge was a part of these actions. The fact that local news media would not pick up the story.
God, that would be just another layer to the onion.
Yeah. I mean, imagine if you felt emboldened to do things like had been done here because you knew that the dying news media was in part propped up by UVA money. It's an interesting thought.
Deep Throat's Company Town reference.
Mm-hmm.
James Watson. Most busy, everyday people just don't care because they have too many important things out in front of them. Also, we are all brainwashed that UVA is the greatest thing since sliced bread, unless you're a Virginia Tech fan. And even then, when you live here long enough, you drink the Kool-Aid as well.
Most do.
I think, James, are you a double who or single who? I mean, I'm a diehard UVA fan. Diehard UVA fan. Bleed orange and blue. But I'm going to call a spade when it's wrong. And the two most disturbing things that are in that report for me was the Craig Ken instructing the pediatric surgeon to perform dangerous surgeries on children.
Bone marrow surgeries. I mean, I don't think those are, not that any surgery is fun or comfortable, but bone marrow is carving out, getting into the marrow, the center of your bones. That's a terrifying thought.
To maximize profits.
Yeah.
When the doctor that's doing the work is telling his boss, we can't do these surgeries because we don't have the people or the technology or the resources to do them safely. And then he says to the doctor, do them anyway. I want the payday. How is that any different than kidnapping a kid with a drive-by white van that has the sliding door and grabbing him with his mom and dad not looking the right way, throwing him in the back of the van and taking him to a backwoods basement? How is that any different?
The difference is that
It's a rhetorical question.
I know, but in the actual case, it's worse because
That's what my point is.
Because parents are bringing their children to you, thinking they can trust you.
Exactly. They're trading on trust. They're trading on credibility. They're trading on an oath. They're trading on the perception that comes with a white coat a stethoscope, a hospital, trust, and exploiting it for profit.
Yeah.
This is the grossest thing ever. This is the grossest thing ever. Children.
Yeah.
People doing work on children, telling a boss or hierarchy, we can't do this, it's unsafe, they could die, and then being told, do it anyway, or you will be fired. That's disgusting.
It's despicable.
That's what's happening here. And then the second most disgusting thing in this report is March of 2020. In March of 2020, the world was terrified. Not so much us here at the I Love CVille Show, who continued as if the pandemic was something exploited by politicians to try to influence presidential elections and alter markets and discourage or encourage voting behavior. I mean, let's cut to the chase. I said that from day one.
His grocery bags.
I didn't do that. I did not wash the grocery bags.
Okay. You washed the groceries.
Someone in my household may have, and I'm not throwing shade at anyone, but I certainly didn't do it. There's plenty of footage in March of 2020 of the I Love CVille show. In February, April, June, we got all the receipts of what I was saying then. Remember when I was saying these vaccines are rushed? There's not enough procedure or protocol or research that went into these? Remember what I said? We're wearing a cloth on our mask, on our face, and that's going to keep something from spreading?
Yeah.
Remember when I said you close these businesses down, but you keep Target and Walmart open, and the small businesses get closed down? Remember when I said that?
I know.
Or how about giving everybody the money to stay home, what that was going to do? Inflation? Or the 2% rates, what that was going to do? I had that all documented on this network and this show. And now we look back on it and we got bamboozled. But in March of 2020, a very large portion of the world was terrified.
Oh, yeah.
And we only had 80 tests. And Kent said, give me one of those 80 tests first, him first, and then his family second, and then handpick VIPs third. And screw the rest of Virginians or sick people. That's the opposite of what a doctor does.
Yeah. First, do no harm.
Yeah. James is a double who, he says.
Nice.
James said he washed his hands after getting the mail. That was during COVID, not now.
I figured.
Wild times. Let's see if we'll learn who covers what with this story. And if the story goes uncovered, then you know moving forward from here on out who you tune into or who you watch for your news moving forward. Because if this story goes uncovered, by media, then you don't watch or listen to that media ever again. Period. And then you allocate your resources, your attention, and your time to the platform that is doing the coverage. And you're watching and listening to them right now. And as Mr. Blair just said, John Blair, you and Judah should be applauded for bringing this story up repeatedly, seriously. I showed up to work one day when this was breaking, all this news was coming out, we were talking about it, and there was a bottle of Johnny Walker Black waiting outside the studio with an enveloped card. And inside the card, on very hard stock paper, it said, thank you. And it was signed Anonymous 128. And there was a bottle of Johnny Walker Black outside the studio. I'm getting text messages now, and I do not know how they have my phone number at all, which is such is life, I suppose. from health system.
The health system?
From employees
Mr.
in the health
The
system.
Health system?
Employees in the health system. Offering gratitude
Nice.
to us. Anything you want to add? Was 65 minutes straight of content and conversation that is unafraid and unabashed.
Even having gone through a lot of this, I did not read all 230 some odd pages. I know there's definitely more to be sussed out of this, and I'm almost afraid to learn any more. This is crazy that this happened for almost half of a decade in our own backyard.
This happened for 4 or 5 years during a time where 3 of those years were the most vulnerable and frightening and uncharted years in American history.
No doubt.
COVID.
Yeah, that's exactly what I was going to say.
When a health system was the supposed lighthouse or North Star for our country, our community, our neighborhood, our friends, our family. Those 3 years, any health system in the country, any hospital in the country, any doctors, nurses in the country, we're our North Star, our lighthouse. And all these 239 pages do is erode and question the trust of health system and science and medicine, when that trust is all we have as men and women when we're sick and dying and vulnerable, we cling to that trust because that trust breeds hope, and that hope breeds a willingness to go into a procedure that's painful, that creates rehabilitation, months of hard work, that may yield an end game like death because it's risky.
Yeah.
But that trust creates hope, and that hope creates a willingness to try something called science and medicine and health. And this report and this doctor and this leader, all he's done is kick that trust.
Undermined it.
Chopped it down, a knee to the balls. That's all he's done. Watch the media here. Judah Wickhauer, Jerry Miller, on what I thought was a pretty good show today. Thursday, January 8th, 2026. Thank you kindly for watching us.